Hello friends, in the last video we have seen the causes and the definitions of the bronchiectasis. Now in this video we are going to learn about the pathogenesis, the clinical symptoms, investigations and the management in short. So first of all we will see the pathogenesis. The most important point in pathogenesis is the infection and obstruction. These two events happens so that the bronchiectasis is caused. So we will see the cycle of pathogens, vicious cycle of bronchiectasis. What happens actually? First of all, there is infection. So this infection will lead to damage of the epithelium of the bronchus, which will in turn cause damage to cilia, and this damaged cilia will be the reason for the pool of mucus in the bronchus. So we know this mucus pool will be the ground for many bacteria, which will lead to again infection. So it will be the good needus for infection of, then this will in turn lead to upper respiratory tract infections. And this will again cause the damage of the epithelium. My writing is not too good. We will clear it and have the cycle again. So first of all, we see that there is infection. Then this infection leads to the damage of the epithelium of bronchi, which in turn leads to the damage of the cilia, which will cause mucus pool in the bronchi, which will be the ground for infections. Good needus for infection, and which will lead to upper respiratory tract infections. And this will again lead to damage of epithelium, and the cycle will be continuous, which leads to bronchiectasis. We will see it in chart form that the infections occurs. Due to the infection, there is inflammation of the bronchial walls. We know after the inflammation there will be the formation of exudate. Then this exudate will cause obstruction, and this inflammation also causes destruction of the bronchial wall. So first of all infection, then inflammation, which will lead to exudate secretion of the mucus and destruction of the lining of the bronchial wall. So this exudate will lead to the obstruction in the bronchial lumen, so which will again, we have seen that it is the ground for infection. Then all this cycle will lead to dilatation of the bronchi. So this is what bronchiectasis. We know that definition of bronchiectasis is characterized as a chronic, permanent and abnormal dilatation of bronchi which contain cartilage and bronchial glands. So now we will see the types. There are 4 types: cylindrical or fusiform, varicose, there comes cystic or secular, then varicose and follicular. Then we will see the symptoms. The most common symptom is the cough, which is chronic and productive. Sometimes halitosis may be seen, pneumonia and pleurisy. Then hemoptysis, poor personal health, weight loss, low-grade fever, anorexia. Okay. Then the investigations, we can do a bacteriological and mycological, that is mycological examination of sputum. Then the radiological examination, in which we can say we can ask the patient for plain chest X-ray. Then bronchography. Then in the chest X-ray, we can see a ring shadow or honeycombing pattern, which is due to the cystic dilated bronchi, or tramline shadows or band shadows. Then the bronchography, which is most accurate diagnostic procedure, particularly when contemplating surgery. So contrast used is the Dynosil. Now it is replaced by CT scan. So the next procedure is HRCT of thorax, which is most sensitive and specific test for diagnosis of bronchiectasis. Then assessment of ciliary function. We know that the cilia are dysfunctioning, and then there is a cause, that ciliary dysfunction syndrome. So to rule out that cause or to treat that, we can do this assessment of ciliary function. Then next is the management. So in the management, we will see in brief that we do the chest physiotherapy and bronchopulmonary hygiene. The chest physiotherapy, it helps in the drainage of excessive bronchial secretions. So the patient should adopt the position in which the lobe to be drained is uppermost. I forgot to tell you that the bronchiectasis, most commonly the site is left lower lobe. So next is antibiotics. there may be ampicillin or an aminoglycoside or penicillin or aminoglycoside combination can be given. Then for pseudomonas, the ciprofloxacin is used. Then surgery role. Nowadays, it is almost disappeared. There are some indications where surgery can be done, that is failure of medicinal therapy with repeated exacerbations, uncontrolled hemoptysis, obstructive lesions, that is tumor. So surgery can be done in such cases. The mainstay of surgery is resection of destroyed areas of lung which are acting as a reservoir of infection.